All right, Dr. Hood, we're ready to get started.
Okay. Well, my name is Lee Hood. I'm an MD from Hopkins, a PhD from Caltech. I really started my career at Caltech almost 50 years ago in 1970. Was there for 22 years as a professor. I moved in 92 with the help of Bill Gates to the University of Washington and started a cross-disciplinary biology department that I ran for 8 years. And then finally, I moved in 2000 to become independent and set up the Institute for Systems Biology, which I've been president of for the last 18 years. More recently, I was associated as chief science officer with Providence. I've recently retired from that position, and now I'm heading up the project that we'll talk about today. So I'll share the slides and get started on this fascinating issue of P4 medicine and what the future of healthcare should be, at least my vision of it. Goodness, why are we having so much trouble? So I'll talk about P4 medicine. We'll define that in just a moment and what the 21st century medicine should be. As I discussed in my introduction, I went to Caltech in 1970, and really my scientific career began there in many ways. One of the major challenges I decided to take on was understanding biology and medicine at a deep molecular level. And of course, what was absolutely daunting about both was the enormous complexity. And in fact, the analogy of the 6 blind men and the elephant was a great one, because they each felt a different part of the elephant and declared it was a snake or a rug or a spear, what have you. And of course, what they were really doing is just feeling the outside of the elephant. And in 1970, in many ways, medicine was very much like that. And in thinking about this analogy, 3 big ideas emerged. One idea was the idea that we should take lots of measurements on an individual human so we could assess that individual, both internally and externally, and look at the biological systems and see whether they're in a normal or abnormal state. And we, as I'll show later, do this by both genome analyses and phenome analyses, and I'll define both of these. What I realized very early on, though, was a very exciting idea is blood was a window into health and disease, because it allowed us to assess, by looking at analytes in the blood, the state of virtually all the organs in the body. Each of the organs was surrounded by blood through capillaries and the like, and secreted informational molecules into the blood, which, if properly interpreted, could give us the state of that organ. And of course, the final point that came out of it was what we later came to call systems thinking. How do we put together all of these data, both from internal, the blood, external, visualization and imaging, in an integrated, global, and holistic way so we come to understand the human? And in many ways, that's exactly what my career has been all about. I remember reading in 73 the structure of scientific revolutions that talked about radical changes in physics. And these were called paradigm changes. And Thomas Kuhn pointed out two very interesting things. One, it's hard to think of a new paradigm change. It requires breaking outside the box. And two, even if you've demonstrated that the paradigm change is operational, is functional, it's very difficult to persuade the conservative scientific population that a change has occurred. And we'll talk about that, obviously, in spades. And over the last 50 years or so of my career, I've really participated in 7 paradigm changes in biology. All of them deal with complexity, and all of them frame my view of 21st century medicine. So I give them to you to give a framework of how I'm thinking about what 21st century medicine should be. At Caltech, I brought engineering to biology by developing their 4 instruments, and later in my career, 2 additional instruments that allowed us to make lots of measurements on human beings. One of those instruments was the automated DNA sequencer, which made possible the Human Genome Project. And I was invited in the spring of 1985 to the first meeting ever held on that project, where 12 of us came to pass judgment. And our conclusions were, 1, it could be done. It was difficult at that time. And 2, about half of us were really opposed to the project because it was big science, and big science would take away from small science. And in contrast, what this big science did was give us access to human genetic variability and the ability to correlate it with wellness and disease phenotypes, a transformational tool that we'll talk about later that is beginning to revolutionize medicine. What was necessary to creating the instruments that I talked about earlier was creating a cross-disciplinary environment, bringing together physicists and chemists and engineers. And I tried to persuade biology that I should start a biology department of that ilk. And the biologists were absolutely opposed to it, I think fearing competition. But Bill Gates made it possible to move in '92 to the University of Washington and start the Department of Molecular Biotechnology, which was cross-disciplinary. And it's in its 8 years of existence, enormously successful in developing new technologies for genomics, for proteomics, for cell biology, and some of the nascent aspects of medicine that we'll talk about later. What happened over that 8 years is I really became convinced that the new idea I was really pushing, namely systems biology, wasn't receiving very much fanfare at the university, and the bureaucracy really got in the way of doing the many new things we had to do to create it. So in 2000, I resigned from the University of Washington to start the Institute for Systems Biology. And of course, systems biology is taking a global, holistic, integrative view toward biology. It's all about generating the big data I talked about earlier on humans, in this case. It's about using network biology to compartmentalize those data into functional components. It's about using machine learning and AI, knowledge graphs, and all the powerful new tools of computing to translate data into knowledge about humans, especially knowledge about wellness and disease, as we'll see later. What then happened as a result of starting systems biology in 2000 is I began thinking in a systems way toward medicine, and very quickly arrived at the conceptualization that healthcare should be P4 in nature. That is predictive, preventive, personalized, and participatory. And I realized then that there were 2 domains in healthcare: a wellness, then largely ignored, frankly, as it is today, and then the disease domain, which is utterly the focus of contemporary medicine. And in thinking about how to approach effectively the wellness domain, We applied in 2014 for the next 5 years, big data to individual humans. We started a company called Airvale that brought scientific wellness to individual consumers. We gathered 5,000 such individuals, the first precision population health study ever done. And with these 5,000 data clouds, we generated insights, which I'll talk about in just a moment, that led us to the idea of the science of wellness and the science of prevention. And at the same time, we realized that a company pioneered by Michael Merzenich called Posit had a very powerful approach to digital brain health. And I'll talk about that in just a moment too. And of course, the final transition was going from 5,000 to a proposal to do genome phenome analysis on 1 million individuals with government support to serve as a demonstration project for how precision population health is what 21st century medicine should be. And it will solve all of the major challenges in contemporary healthcare, including the quality of it and the enormously expanding cost of it. So in summarizing again, the whole vision we have is that healthcare should be predictive, preventive, personalized, and participatory. And the integration of those things, the first 3 P's are all about science, and the 4th P is about sociology and psychology. How do you persuade people at the patient level, the physician level, the healthcare leadership level, the regulatory level, the pharma level, the technology level? How do you persuade these people to participate in what is going to be a striking paradigm change in healthcare? And that is obviously the enormous challenge for the future. So the vision of scientific wellness and prevention is one of precision population health. And what I mean by that is assessing and optimizing the health trajectory of each individual for body and brain health, and being able to deal with its 3 major features. We all start in wellness. Almost all of us transition to a disease a number of times during our life, and hopefully we progress back to wellness. But at the end, we usually end up in disease with major physical and or mental ailments when we die. And of course, the vision that I'm talking about is that number 1, we'll be able to detect very early those transitions years before the disease manifests itself clinically. And when that disease is very simple for reversal. So we'll learn to identify the transitions and reverse them for each of the major chronic diseases. And in doing so, we'll leave the individual in a series of wellness phases intersected by reverse transitions, so that we all have the potential to move into our 90s mentally agile and physically capable. So this is the execution of P4 medicine. It will be predictive, preventive, personalized, and participatory. And I'll argue it'll be the largest paradigm shift ever in the history of medicine. And let's talk in a little bit more detail about a project that we've now called Beyond the Human Genome Project, that builds on the first Human Genome Project. It sequenced over 13 years, 1 genome sequence. Beyond the Human Genome proposes to sequence 1 million individual sequences and determine their longitudinal phenomes, which we'll define in a moment, over 10 years. We'll convert these data into actionable possibilities to improve health, that is wellness and prevention for body and brain. We're going to seek, and we are seeking, federal support from this, from the government. And we hope over a period of 10 years, this demonstration project will compellingly demonstrate the power of the science of wellness and prevention. We've created a nonprofit organization, Phenome Health, which is going to direct this effort and create the partnerships that will be necessary to actually catalyze it. As you know, the genome is the 3 billion subunits in the haploid chromosome set, and it's invariant across life. And it's basically the source code of living. And each individual has an absolutely unique and invariant genome. The phenome, by contrast, is a reflection of the individuals. And there are 3 features: lifestyle, genome, and environmental exposures at any point in time. Hence, your lifetime represents an infinite number of different phenomes. And of course, the phenome can be assessed at any time by analyzing blood analytes, the gut microbiome, digital health measurements, and many other things we'll talk about for body and brain. And to give you an idea of the contrast between the first genome project, again, which did 1 human genome, and the second genome project, this is beyond the human genome, it uses phenomics, and it allows us to look at a person across their lifestyle distribution, assessing the phenome at many different points to create a longitudinal data cloud that give us new fundamental insights into wellness and into disease. And I'll show you the power of longitudinal phenome analyses. We've 2 populations we've examined as proof of principle for this precision population health. One is the Airvale population of 5,000 individuals over 4 years, where we did genome longitudinal phenome analyses. And I'll talk in enormous detail about how observations from that have led us to the science of wellness and prevention. The second approach is done by Posset and Michael Merzenich, initially at UCSF, then more recently at the company Posset, where they have 40 digital brain measurements for cognitive assessment of healthy and diseased brains. And they've done more than 10,000 patients across 250 clinical trials. So this approach is now very well validated. In the Airvale population, we did whole genome sequence. We analyzed about 1,200 blood analytes twice a year, including clinical chemistries, metabolites, and proteins. We analyzed the microbiome twice a year to assess the microbial species contained therein. And then we did digital tracking with a Fitbit and other measurement devices to get quantized self-measurements. The integration of these data led, as we'll see in just a moment, to correlations of fascinating data features that led through the literature to more than 200 actionable possibilities that, if acted upon, will either improve health and or let one avoid disease. And the research insights that came from these data clouds were striking. So, for example, with the first 108 people we looked at, we were able to do statistical correlations across 6 different data types, looking at a data bit in one type, asking, was it statistically correlated with changes in the other 5 data types? And each of the fascinating correlations led us to the literature and the validation of actionable possibilities, the 200 or so we were able to define. And of course, this was the essence of this company called Airvale that used the individual data clouds plus coaching. And the coaching was key both for education of the patients and pushing the patients to execute the actionable possibilities. This led to action at a very successful rate and successful outcomes that gave us 40 genetic insights, 40 blood markers that had relevance to wellness, customized nutrition, heart health, digestion, and the like. And the 5,000 people in Airvale were enormously happy. And they came to realize that wellness is a fascinating thing. For example, most people maybe have 20 or 30% of their wellness potential. And it's these actionable possibilities as we integrate them into our life styles that lead us to increase and move us up to optimize wellness to get to the point of Eric Topol's elderly individuals in their 80s and 90s that have been healthy their entire life, never used drugs, never been in a hospital, and go into the 80s and 90s mentally agile and physically healthy. And our argument, and it's a hypothesis, is scientific wellness with these actionable possibilities, if practiced across your life, will take you healthy and capable into your 90s, giving you an extra 20 or even 30 years of productive and creative possible life. And the important point is there are two dimensions to wellness. One is increasing your potential wellness, and the second is increasing the length of your lifespan to be equal with your health span so that you're healthy all the way out to the end of your years and so forth. The research insights went on from just scientific wellness to looking at people that varied in age from 21 to 90 plus, dividing them into 10-year categories and showing there were striking linear changes in the levels at which you could control the expression of your blood analytes as you aged. And from these observations, we were able to develop an algorithm that let one determine their biological age, the age your body says you are, as opposed to the age your birth date says you are. And what we demonstrated in Airvale is for each individual that practiced successfully in Airvale, they lost 1.5 years of biological age per year they were in the program. A remarkable blocking of the aging process. I had a friend in that program who actually lost 10 years in the 4 years of the program, and it raises interesting questions about the reversal of aging. The other point we demonstrated is that sick people are biologically older in every case than their chronologic age, whereas the well people are always well below their chronologic age. So we looked at 40 different diseases seen in the Airvale population. Every single one had an average biological age well above their chronologic age. Diabetes was the most extreme, with the average biological age 6 years older in the 300 people that had diagnosed type 2 diabetes. The other thing that was striking is because we now use metabolites to determine the features of biological aging, we're able to do aging in organs as well as a global biological age. So we can look at liver age, at kidney age, at lipid age, at immune age, at metabolic age, and optimize each of these features in ways that make you age in a more healthy fashion and drive your average age even further below your chronologic age. So the metric for measuring your biological age is a very powerful metric for wellness as well. Now, two other features that we looked at were the ability to convert polygenic scores, that is, genetic analyses of the many variants that added to the genetic risk of given diseases, and there are about 100 of these now. We looked at 54 different polygenic risks and converted them into risk for the disease in the airfield population. And then we correlated all sorts of interesting features with increasing genetic risk. And for LDL cholesterol, increased risk, that's a proxy for cardiovascular disease, we were able to show very high-risk people had the ability to bring their LDL cholesterol only down with statins, whereas those that were at low risk and had high cholesterol could do it with diet, exercise, and the like. And this led us to conclude that high and low genetic risk individuals in the future are going to be treated differently, and it will be essential to know what your genetic risk is for the 100+ diseases we can look at today. The final point we made, which was one of the most striking, is that we had 167 individuals in the Aravale population of 4 years transition from wellness to disease, all the major chronic diseases. And we were able to look at blood samples taken prior to the clinical diagnosis and show for 10 cancer examples, we had transitions in blood analytes that were outliers up to 5 years prior to clinical diagnosis of the disease. So it means, one, we can diagnose at the earliest stage chronic diseases, and two, this gives us the means with academic and pharma collaborations to actually develop therapies to reverse chronic diseases before they ever manifest themselves clinically. And we're already beginning to do this in an interesting way with Alzheimer's, as I'll show you in a minute. So the science of wellness includes the actionable possibilities, the quantitative wellness I've talked about, and the ability to optimize healthy aging beautifully. The science of prevention includes being able to use genetic risks to determine treatment and to predict the transition to chronic diseases early with the potential in the future of reversing them. We've looked at Alzheimer's in this context, and I'm not going to go into all the things we've done, but I will say we're able to show Alzheimer's stratifies into at least 6 different subtypes using blood measurements. We'll talk about genetic risk in just a moment. Women are at much greater risk than men, and we've now had a number of clinical trials that beautifully demonstrated multimodal therapies that use both lifestyle and biochemistry can be used effectively, not only to reverse early stage Alzheimer's, but hopefully to prevent it if you're at high risk for this disease. And we have populations that we're studying in all of these regards now. And let me make the point that the major gene that leads to Alzheimer's is one called ApoE4. And we've looked and individuals have looked in 4 different populations using about 500,000 different individuals to show that if you have ApoE4 in a Caucasian, and you're homozygous for it, by the time you're 65, you have a 65% chance of Alzheimer's. And that means you've got a risk that is kind of 13 or so. But in contrast, if you're Japanese, you're much more likely to get Alzheimer's as homozygotes. In fact, 3 times as likely. And what is really striking is if you look at Hispanics, ApoE4 doesn't increase your risk for Alzheimer's at all. So what is critical in what we're doing in Beyond the Human Genome Project, this 1 million person project, is getting racial diversity that approximates that of the US population so we can treat different races in appropriate manner. Microbiome health is a brand new opportunity. The key thing we know about microbiome health now is more diversity is almost always good. And we actually used our airflow measurements to show that we can look at 11 blood analytes and we can assess your microbiome diversity beautifully. And we're going to be using this retrospectively to go back and look at interesting populations for which we have blood samples and assess the contribution to their phenotypes of the microbiome. Even more striking, recently we studied 9,000 individuals in their 60s, 70s, and 80s with regard to their microbiome and healthy aging. And what we were able to demonstrate for those who aged in a healthy manner is one, the core taxa of microbes that you have in your 20s and 30s, by the time you age into your 80s is lost completely. And two, each individual, healthy individual in their 80s uniquely defines a microbiome presumably selected for your needs. So each 80-year-old microbiome is completely different in healthy people from the others. In contrast, the unhealthy people never lose the core taxa, nor do they differentiate individually, as you see in the healthy people. And of course, this raises fascinating questions of, can we promote a healthy microbiome differentiation and loss of core taxa in unhealthy individuals? And this obviously is something we're exploring. We've published over the last 4 or 5 years more than 13 high-impact papers that have supported all of the things that I've talked about here. And the one final thing I'd talk about is this brain health, which I mentioned briefly. 40 digital measurements let us look at 25 different cognitive features, including reaction time, depth of field, and memory. And what Merzenich got the Kevley Prize for, he's a National Academy member, is he demonstrated that the developmental trajectory of our cognitive functions rise to a maximum in our mid-30s and decline for almost everyone thereafter. But he demonstrated in hundreds of 80-year-olds that for most, you can restore most of the cognitive functions back to what they would have been in their mid-30s. So it is a digital management of brain optimization for wellness. And he has the ability to actually predict those that are susceptible to depression, drug addiction proclivity, schizophrenia, PTSD, TBI, etc. So, and here are 2 published papers that really summarize beautifully the powerful approach to brain health. How many physicians ever ask their paper, how's your brain? Is it healthy? I have yet to find a single patient who's ever been asked that question. And we think that body health and brain health are absolutely critical for this new 21st century medicine. So the science of wellness is optimizing scientific wellness through body health, optimizing one's aging, optimizing your cognitive brain health and so forth, optimizing your gut health, and then integrating all of these things and coming to understand how they cooperatively affect body health together. And of course, the science of prevention is using our polygenic risk scores to treat people appropriately for high and low risk and following those at high risk closely so we can reverse their very earliest transitions. We'll use these reversals to chronic, the metrics from blood analytes for chronic diseases to diagnose transition and be reversed at time. And of course, the digital brain diagnoses can be used to manage and optimize and prevent disease, just as we prevent disease through wellness. So beyond the human genome then is using the same genome phenome analyses but we're adding to it the 40 digital brain measurements. We're adding to it longitudinal electronic health records, and we're adding to it the social determinants of health and outcomes of patients. And these will give us a powerful platform that can give us a myriad of integrative opportunities for designing precisely precision population health. We have Phenome Health has 7 major partners. Guardian Research Network has access to 120 hospitals in 13 states in the South and Southeast. They've consented all of these patients for a project like the Beyond the Human Genome Project, the Million Person Project, and they've acquired already the ability to extract electronic health records, both for structured and unstructured data, that is doctor's notes and path reports and things like these. So they'll become a valuable part of the data we can integrate together with other data. Posit Science is going to carry out the health assays we've talked about. We've contracted a company called Technicity, which it built the major computational platform Amazon uses for one of its major programs. And they're helping us modernize the Airveil platform and modularize it so we can give essential components of that program to partners as they come in, be healthcare systems or pharma or even technology partners. We're collaborating obviously with ISB. A company called Bioanalytica will generate the data for us. Deloitte has made major commitments to helping us partner with major individual companies across the healthcare sector and to help us manage this big project and to put substantial resources initially into the program. And Google has done the same thing for its 4 major components in Alphabet, namely digital health, search, cloud platform, and hyperscale AI. So they're really exciting possibilities. And Google is working with us on this new expanded platform for scientific wellness and prevention. We've explored partnerships with NIH, DOE, and VA, including the All of Us program, and there is certainly interest there. We have an outstanding advisory board I'll show you in a moment. I have been lobbying actively Congress. On the 8th, I presented to a subcommittee in the House on the question of how do we convert clinical research into actionable possibilities for patients. And it was a fascinating experience. And we're persuading a couple of small healthcare systems to join us and to revolutionize family practice and to bring to it the science of wellness and prevention. Here's the advisory council, number 2 at Amazon until recently, Jeff Wilkie, number 2 at Merck, Roger Perlmutter, Victor Zhao, who is president of the National Academy of Medicine, and George Church, who is a pioneer in technology and genomics, who is actually collaborating with us actively on the project. What's unique? So what does recording stopped mean?
That was an error. You can continue, Dr. Hood. It's being live streamed.
Oh, okay. So what's unique about Beyond the Human Genome Project against all of the other 500,000 and million person projects? One, we're going to carry out longitudinal phenome analyses for body, brain, and microbiome and integrate all of these data together in a meaningful way, looking for thousands of new actionable possibilities to push patients towards scientific wellness. We're going to feed individual data into Google's hyperscale AI and be able to do massive correlations and create hypotheses for testing, the likes of which have never been seen before. We're going to include academic and industrial partners to analyze the data ecosystem we'll create in the context of their own interests and transfer that knowledge to society. We'll develop blood biomarkers to identify patients that respond to drugs. I'll say more about that in a moment. And we're going to take the four major, most costly chronic diseases, cardiovascular, neurodegenerative, diabetes, and cancer, and we're going to stratify them into their subtypes so we can target therapies at discrete subtypes, and the subtype numbers are going to be large. We'll create an accelerator incubator for spinning out companies, and we're beginning to create international partners for this whole endeavor. So on the stratification of the four chronic diseases today, if you use a particular drug, you're lucky if 15% of the patients respond. We'll be able to stratify probably for the major chronic diseases, diseases into perhaps 20 to 40 different subtypes. And for each, we'll collaborate in targeting drugs that can deal with them effectively. And it's a whole new paradigm for drug discovery and treatment that we can talk about. Drugs cost $6 billion a year. And if you look at the 10 top selling drugs today, you find that less than 10% of the patients respond to the drugs, an appalling number and an appalling cost that is utterly unnecessary, while at the same time exposing the 90% to the complications, off-target kind of drug things. We'll be able to create biomarkers that can identify the pink individuals that are responder, and will correlate drug with response. And in principle, think of the money that could be saved in drugs with a simplistic approach. With our collaborators, Google and Leroy, we're going to have the resources to start some very high dimensional clinical observations in the short term for type 2 diabetes, stratifying the patients into their four different successive transitions and looking at four different clinical trials that in 3 to 4 years could do what would otherwise take 20 years to do. And this is going to open up exciting new possibilities. We're going to do it for pediatric diabetes and depression and AML. It's an ideal cancer subject, and we'll take longer term clinical trials for Alzheimer's and for aging and anti-drugs. And of course, as we do these trials, we'll be able to spin off what we call verticals, that is brand new companies that will have enormous insights in how you deal with each of these different diseases with regard to stratification and responsiveness to drugs and the like. So the deliverables are a big data ecosystem that will promote innovation, and it will be open data available to all. A biobank with samples from all the million patients for discovery, data-driven hypotheses. We'll make computerized platforms for the education of patients and physicians and patient consenting. We already actually have those. And we'll automate the computational platforms for every aspect of data generation, handling, and analysis. We'll include minorities because the Guardian Research Network lies across big African American and Latino minorities, and we'll actively get them in proportion to what they are in the human population. That is the whole idea of equity, inclusion, and diversity, equity, and inclusion. New approaches to automate the analysis and integration of vast amounts of data will come out of hyperscale AI that we're collaborating with Google on, and we'll have a network of academic and industrial partners that will serve jointly to innovate and to discover. And of course, trust is absolutely going to be key. So we'll validate the science of wellness and healthy aging for body and brain. We'll validate the science of prevention for body and brain. We'll be able to stratify really all the major chronic diseases into their subtypes and deal with those therapeutically. I think we'll generate 10,000 new actionable possibilities. There'll be striking healthcare savings, and I've given you a couple with wellness, disease stratification, and efficient drug use. The equity question we'll deal with. We're going to transform healthcare from a disease-oriented to a wellness-oriented entity. We'll create many new companies and catalyze and send out all of the new knowledge that comes from the enormous capture of data, and hopefully catalyze a value-based medicine that operates through keeping populations healthy rather than how many times you've touched the patient. World leadership in science and medicine. And I'll close by saying this Beyond the Human Genome offers powerful solutions for the four major challenges of contemporary healthcare. It's poor quality, it's rapid expanding of the aging population, the explosion of chronic diseases, and its inappropriately increasing level of cost. Thank you very much.
Thank you very much, Dr. Hood, for this nice presentation. Excellent work. Very, I think, yeah, these are very nice insights into the future of medicine. Thanks a lot.
Dr. Hood, this is Rod. That was terrific. I always learn so much from you. And, you know, I don't know if you remember, but I enrolled in the Airvale.
Oh, I do remember that, Rod.
Study. And it's, you know, what was amazing to me is that I think there's so much information that we don't know about ourselves. Like, you know, and when I enrolled in Airvale, you know, I remember we did all these lab tests, and I told you, you know, and it's amazing, like how much information you can get. And then I think what I learned from it is how little, like, my primary care doc and the healthcare system, it's set up to treat disease and not prevent disease. And
absolutely.
And what's fascinating to me, I kind of took, I wanted to ask your advice, and also I wanted to get your thoughts on, I think, three things I wrote down is that, you know, and I think this is what I learned from Airvale, is that P4 medicine and what you did with Airvale, I think it was almost like, it was like too far forward for the general population right now. So how do you think, you know, because this is the problem, I think, is that insurance companies, hospitals, the entire system is based on treating disease, right?
Yeah.
And so, you know, like if my primary care doc wanted to order these labs that we did at Airvale for me, they would never get reimbursed for it, and they would never be able to order them. So how is it that we're able to do P4 medicine early on when it counts to try to identify, you know, these things? Like, for example, for me, I found out some genetic things about my cholesterol, you know, I mean, all these things I would have never, like, you know, like orthopedic things that I would have never gotten.
Well, you know, Rod, that is a superb question. And the deep insight I gained after Airvale was realizing that the cost of the assays was very large, and that physicians didn't really necessarily believe they led to legitimate, actionable possibilities. And this is exactly why I'm asking the government to put $10 billion over 10 years into this program. It's a demonstration project. We'll unequivocally be able to show that it improves wellness, and wellness decreases strikingly the cost of healthcare. And it will be an incentive for driving down all the measurements in striking ways. The first Human Genome Project drove down the cost of DNA sequencing by 10 million fold, okay? I propose that the phenomic measurements that we're making may not go down that far, but if you just drive them down 100-fold, everybody will be able to afford them. And when you couple together their low cost with what they do for health, the payers are going to pay for them. So the demonstration project paid for by the government is a critical proof of principle. Okay.
And then that's great, Lee. I'm so glad you're doing all this. And then I wrote down a couple other things. Is that so for me, what was fascinating, and I learned this actually from you, is that there's this whole component at a cellular level, and it actually touches on a bigger subject, which is intermittent fasting. So what do you think the intermittent fasting, how does that play a role in the biology of aging, preventing disease? And is that something you guys are looking at as well?
Absolutely. And I'll tell you, I practice intermittent fasting every single day. And I found it makes an enormous difference in how I feel. B, it is a wonderful governor for weight. So my weight now is exactly the weight when I played college football. So, I mean, I don't have all the muscle I had then, but that's pretty good. And I think intermittent fasting has an enormous impact on biological age. And I've done the intermittent fasting now for years. And my biological age is about 15 years below my chronologic age. So, I'm going to be around plenty long enough to complete the Beyond the Human Genome Project and then some. So if you want to age in a healthy way, I put intermittent fasting near the top of things I would recommend. Okay. And you can ask, what's the proof of it? And there is some kind of fuzzy, vague proof, but I would say experimentally, what it's done for me has been really quite remarkable.
And then one last question, and then I'll quit hogging the platform here. Is you discussed Alzheimer's and that you guys are doing all this work on it. And it's, I think, fascinating for this group because there's a bunch of neurosurgeons and neuro physicians. Is that, what do you think, let's say if you have a tendency or predisposition and genetic history and all those things, what are things to prevent? What can we tell our patients? Like you said earlier, we don't discuss brain health. We don't discuss all these issues. What are kind of several actionable items you think we could do for our patients today?
Well, I'll tell you, just to put it in perspective, my family has a terrible record for Alzheimer's. And in fact, my son is homozygous for ApoE4. So what I've done for him is to use this multimodal therapy that was first proposed by Dale Bredesen in a book called The End of Alzheimer's, which took an enormous hit from the expert at NIH who had worked on Alzheimer's for 15 years and hadn't done a goddamn thing to improve it or treat it or anything else. The finger trial actually came out a little later than Breseden's proposal, and it really supported him. And there have been subsequent trials showing this multimodal therapy, which deals with specifics of lifestyle, of environment, and of optimizing your blood biochemistry, really is beneficial. So I have my son on this multimodal therapy in the preventive mode. He's 53. And so he's 5'10", he weighs 149 pounds. He is an ultra marathoner. He's in superb shape, and he hasn't got and all of the biochemistries in his blood are fantastic. So I think this multimodal therapy is going to be a preventive that really is going to, if you're willing to practice it, you'll never get Alzheimer's.
What's the multimodal therapy, Lee?
It's really complicated, but it has
Okay.
to be, it deals with intermittent fasting.
Okay.
It deals with optimizing blood biochemistry. It deals with looking at environmental toxins, which and black mold is a very common cause of Alzheimer's. And you get rid of black mold and it can absolutely transform early stage Alzheimer's. But so there are a whole series of things. And what I would say is if you're really interested in this, skim Dale Bredesen's book. It was the New York Times bestseller. And a lot of those ideas have been very much improved and optimized. And so it's multimodal. You're doing many, many different things. And diet is a key part of it too. Okay.
Great. Thanks, Lee. Great talk, by the way. Great to see you.
It's good to see you, Rod. Yeah.
Dr. Hood, this is Akshal. I'm one of the neurosurgeons. Nice to meet you and a great talk. I just had a quick question because the most interesting thing about this whole P4 project is actually the behavior of people and the psychology of people and changing that. You know, I think that people who are motivated to change will always drag towards that median to change. Given, you know, this is a loaded question, given like, for example, the recent anti-vax movement, you know, how do we help from a psychological standpoint of all these things kind of moving those people towards thinking about wellness, you know, in a positive light?
Yeah. Boy, that's really a good question. I think the hardest part of this project by far is the fourth P, participatory. I think the science we can handle, we know how it's going to go. It's going to work just beautifully. But persuading people at all levels to accept it is a different thing. And I think what's key is education. So I'll tell you how we're thinking about it. When I started ISB, created an education group that was focused on K through 12 science education, and it's been superbly successful. What we've done in the last couple of years is create a healthcare full year course with 20 modules on P4 medicine and systems medicine. So when those kids graduate, they'll know infinitely more about these things than 99% of the physicians out there. And we're setting this course up so it can be easily spread to across the country. We created in the early 2000s a similar course for systems biology. And I can say now it's used in all the states. It's being used in 100 different countries, and way more than 3 million students have gone through that course. That is exactly the kind of thing we're going to try and point toward. And we're going to be modifying this course to take it to junior college and undergraduate. And we're going to be modifying it to be able to give it in a bite-sized fashion to physicians. So I think the real key is education in simple quantized steps that people can accept. But wouldn't it be wonderful to have graduating from high school kids that know what P4 medicine is and know about vaccines and why they're key and how, you know, it's great to have individual freedoms, but if your intransigence in getting vaccines is going to harm other people, you have a social obligation to get, you know, something that the Trump people have never really learned, unfortunately. But
Thank you.
so I think the key is education. But so to give you two more examples of what we're doing, I've gotten to know an Italian film director who's made Cannes documentaries, and I've persuaded him to do a documentary on wellness and Beyond the Human Genome Project. And we're going to film this all over the world and make it dirt simple, make it easy for everyone to understand. And that is the kind of thing that can reach out to literally billions of different people. We're putting together a couple-year program with Scientific American. And one of the things they've agreed to do is at the end of this next year, put out an 80-page little booklet on wellness, talking about all of its dimensions that can be in grocery stores and airport bookcases and all of these kinds. So I think just reaching out in many different ways. I'd like Hollywood to create a program on medicine that is oriented around a problem-solving approach as we do for forensics. And I think with good writers and actors, we could do something that would be enormously educational. So those are some of the things I'm thinking about.
Thank you.
It's a great question, though. The fourth P is how you change the psychology and sociology of, the other thing about the fourth P is, do people really want to live to be 100 and be functional and creative? I mean, are you going to have enough money to live well? And I mean, there are a whole series of sociological questions that go, what's retirement mean if you're utterly healthy when you're 60?
Right.
It's going to be fascinating.